Wobenzym tablets is a combination drug. It is a combination of highly active enzymes of plant and animal origin. It has an immunomodulatory, anti-inflammatory, fibrinolytic, anti-edematous, antiplatelet and secondary analgesic effect. Wobenzym has a positive effect of the course of the inflammatory process, limits the pathological manifestations of autoimmune and immunocomplex processes, and has a positive effect on the parameters of the body's immunological reactivity. Indications for use. Wobenzym is used as part of the complex therapy of inflammation, swelling, and pain in trauma, thrombophlebitis, arthritis, including rheumatoid arthritis and arthrosis. How to use. Set individually depending on the severity of the disease. Adults, depending on the activity and severity of the disease, are prescribed in a dose of 3 to 10 tablets, 3 times per day. In the first 3 days of taking the drug, the recommended dose is 3 tablets 3 times per day. With an average activity of the disease, the drug is prescribed in a dose of 5 to 7 tablets 3 times per day for 2 weeks. In the future, the dose of the drug shall be reduced to 3 to 5 tablets 3 times per day. Course 2 weeks. With high disease activity, the drug is prescribed in a dose of 7 to 10 tablets 3 times per day for 2 to 3 weeks. In the future, the dose shall be reduced to 5 tablets 3 times per day, course 2 to 3 months. In chronic long-term diseases, Wobenzym can be used according to indications and courses of 3 to 6 months or more. In order to increase the effectiveness of antibiotics and prevent dysbacteriosis, Wobenzym shall be used throughout the course of antibiotic therapy at a dose of 5 tablets 3 times per day. After stopping the course of antibiotic therapy to restore the intestinal microflora, Wobenzym shall be prescribed 3 tablets 3 times per day for 2 weeks. During radiation and chemotherapy, Wobenzym should be used at a dose of 5 tablets 3 times per day until the completion of the course of radiation and chemotherapy in order to prevent infectious complications, improve the tolerability of basic therapy and improve the quality of life. For prophylactic purposes, Wobenzym is prescribed 3 tablets 3 times per day for 1.5 months with a repetition of the course 2 to 3 times a year. Children aged 5 to 12 years are prescribed in a daily dose at the rate of 1 tablet per 6 kilograms of body weight. For children over 12 years of age, the drug is prescribed according to the scheme intended for adults. The duration of treatment is determined individually. The drug shall be taken at least 30 minutes before meals, without chewing, with water, 200 ml. Contraindications. Diseases associated with an increased likelihood of bleeding, including hemophilia, thrombocytopenia, carrying out hemodialysis, children aged up to 5 years, individual intolerance to the drug. Special instructions. It should be borne in the mind that at the beginning of treatment with Wobenzym, an exacerbation of the symptoms of the disease is possible. In such cases, it is recommended to temporarily reduce the dose. Treatment should not be interrupted. In infectious and inflammatory diseases, Wobenzym does not replace antibiotic treatment, but increases their effectiveness. Wobenzym is not doping. Side effects. Wobenzym is generally well tolerated by patients. In most cases, side effects, withdrawal syndrome, addiction were not observed even with prolonged use in high doses. In some cases, slight changes in the consistency and smell of feces, urticaria, pass when the dose is reduced or the drug is discontinued. The patient should be warned that if other adverse reactions occur, it is recommended to stop taking the drug and consult a doctor.